So this year, looked around and said, hey, you know what, here's something that's so obvious, I can't believe we didn't look at it earlier. The state employee plan, why don't we just open it up? There's already 200,000 lives in it. We don't have to get a critical number of people to join already. We already have a critical number of people in already. We'll just open it up, and whoever wants to come in, come in. It's like that, movie, if you build it, they will come. You know?
Competition. On the other side are people for universal health plans who say if it's going to cut your costs by having a plan with 200,000 people, why not bring everybody in? Why don't we just have a universal single-payer plan that has the whole state?
I think, and we'll bring Representative Donovan into this question as well. We support having a voluntary approach, and I think the reason this piece of legislation is doing very well, moving through the process, is because it's voluntary, and the people who think it can provide their families and their businesses with a benefit will come in. Also, a lot of municipalities are interested in saving money for their taxpayers, and they're very interested. So I think the voluntary approach is
so this is single payer for you. The key issue is voluntary. Is that because it won't sell if it's mandatory? Is that too much political opposition?
I think that this program has been successful for the state, and I think if it is voluntary, we will see support in the legislature, and we will have the benefit of nonprofits coming in, of small businesses coming in, and also municipalities. Do you want to add on that?
Well, Chris, why not just have everybody?
Well,
why limit it to nonprofits, small businesses?
Are not.
People want choice.
Well, no, I think people are confused about health care. And I think this proposal is to get people to realize that they can have a good health care plan that actually saves money. Where people don't believe that. They believe that if you're going to have a universal health care plan right now, it'll be a bad plan. It'll be Medicare Part D, and it will cost money. So we're showing the public that you can have right now a good health care plan. And I think, to me, my motivation is that I want everybody to have a good health care. So I want to set the model that here's an inexpensive, good health care plan. Other people are offering plans. Jody's plan right now is a low-benefit health care plan. That's not a good idea. From my perspective, I support her, have a right to offer that, but I don't think that's a good offer because we hear people and we end up paying for all those other costs anyway. So I think.
So if you succeed in passing this and convincing people, would the next step be?
Well, I think the next step is the
universal plan.
I want the public to demand it. In some ways, I want the public to say we want it.
Well, why not lead them to demand it?
Well,
you're doing that.
I'm leading it this way. I'm leading it this way by saying, if you want it, come take it. It's right here. And when they